Prior to recording this video, I screened my patient for COVID-19 signs such as coughing, fever, sore throat, and cold-like symptoms before recording, and my patient did not have any.
Hello, ma'am. How are you doing today?
Good. My name is Ophelia, and I'm going to be your nurse for today, okay?
Okay.
All right, I'll do my hand hygiene. Hold the door for privacy. Okay. Can you please verify your name for me? What's your name?
My name is Adela Peter.
What's your date of birth?
January 4, 1984.
Thank you. Okay. Do you know where you are today? Yes. Where are you?
I'm in the hospital.
Okay, you know who the current president is?
Yes.
You know what day today is?
Yes.
Good. So my patient is alert and oriented times 3 to place person in current situations. So I'm going to do a 32 assessment. Is that okay with you? Okay. So with my assessment, I'll begin with inspection, auscultation, percussion, and palpate. So I'll begin with assessing the patient's skin. So I'll inspect the patient's skin for any lesions, any bruises, and the patient is the skin is dry and intact. Okay. So I'll start with your head to toe. Okay. So I'll first inspect the patient's head for any symmetry, and I'll palpate for any masses, any lesions, any alopecia or any infestation. And the patient does not have any. From there, I'll move and check for the patient's ears. I'll pull up and back to check for any vertices. On the same side, pull back, up and back. There's no any abnormalities. So check for the patient's vision. Patient vision, I'm going to use the acronym PARLA. So, Ms. Adela, can you please take your eyeglasses off for me? So I'm going to shine the light in your eyes to check for any restrictions. Yes. So restrict, constrict, and constrict. So I'm going to check for any shaking of the eye by using the 6 field of cardinal field, okay? So you focus on the pen light for me. And there's no shakiness. So from there next, Adiola, I'm gonna pull your mask down to check for any drainages. Okay. Can you tilt your head back for me? Okay. Nose is dry. Can you open up for me? So mouth is moist. There's no any cancers in the mouth. Okay. So from this part, I'm going to palpate. I'm going to check your neck, assess your neck, palpate your lymph nodes. And I'll check for the trachea if it's midline or any deviation, and there's no deviation. So I'll go ahead and check for your carotid arteries, okay? Carotid artery. It's regular and it's regular, both sides. I cannot do 2 sizes at the same time because I want to prevent any occlusion from the brain. So from this side, I'll go ahead and check for your heart sounds, okay? So I'll start, I'm going to expose you a little bit, okay? So I'll start with the, on the right side, in the mid-clavicular line, the second intercostal space, and listen to the aortic valve. I can hear S1, S2, and then move to the mid-clavicular line, the second intercostal space, and listen to the pulmonary valve. S1, S2. I'll listen to the air point, the tricuspid valve in the 4th intercostal space, and the mitral valve in the 5th intercostal space. The apical pulse, we would have listened for it for 1 minute, and this is the point of maximum impulse. I'll listen to your lung sounds. I'll first start from the anterior part and then move to the posterior part. Miss Adiola, you're gonna take a deep breath for me, okay? I'll start above the clavicle. Take a deep breath for me. In. So I'm doing this sequence to check for any adventitious sounds on both sides of the lung. And I didn't hear. And I didn't hear any sounds. Okay. So I'll do the same procedure. Take a deep breath for me, in and out. And I didn't hear any adventitious sounds. So from this point, I'm going to palpate for your radial pulses and your brachial pulses, both bilaterally. Both are regular and 2+. Both are regular and 2 pluses. So I would have checked for the femoral pulses in the groin area, but since we cannot expose this patient, I would have checked it in the groin area. And the popliteal pulses behind the knee, with the knee areas. And then I'll check the dorsal pedalis pulses at the top of the foot. And then the tibial pulses, I'll go behind the foot. So after I'm done with this, at this point I'm going to listen to the patient's lung sounds. I'm going to check for the bowel sounds. With the sequence, it's a little bit different. We are going to start with an inspection. We inspect the belly and the skin, and then we auscultate, we percuss, and then we do palpation later. So I'll start from the lower quadrant, the right lower quadrant, move up to the upper quadrant, across the left upper quadrant, and lower left quadrant. And the bowel sound is normal. There's no any abnormalities. Okay. So at this point, I'm going to check for the musculoskeletal strength. Okay, so Miss Adiola, squeeze my hands. Okay, extend your arms. Okay. All right. Can you push against me? Do your hands like this, and then push against me, okay? Good. Push against me. Push against me. Okay. And there's equal strength. If there's one side not equal, we'll probably attribute it to either stroke or the patient has Bell's palsy.
Instinctively, I'm like, oh yeah.
So, Ms. Adiola, the assessment is complete. I didn't find any abnormalities, so I'll go ahead and document, okay? Thank you for your time. Wash my hands, and that's it, right?